A person under observation has tested positive for the novel coronavirus. This is the first case in the country. The patient is currently admitted at a government hospital in Manila. Here's more information from the Health Secretary himself.
It's been more than a year now since the COVID-19 pandemic has raged all over the world. Since then, a balance of good leadership, global cooperation, effective health systems, and scientific research are the factors that we depend on to drive us out of this crisis. As of late, there is a reported total of 170 million plus COVID cases worldwide, 1.2 million of which is accounted for by the Philippines. With such a grave health issue at hand, it seems natural to turn to science for a solution, a vaccine. Though the idea of having a fighting agent placed in our bodies is not something welcomed by all, just like anything else we chance upon in life. That said, it then becomes a question of the self, as part of something bigger. COVID-19 vaccines are now available to people here in the Philippines. The government offers hope by allocating funds for the health safety of the citizens. The COVID-19 vaccine will help prevent the spread of the virus. According to the Department of Health, vaccines will mimic the virus or bacteria that causes disease and triggers the body's creation of antibodies. These antibodies will provide protection once a person is infected with the actual disease-causing virus or bacteria. Taking the vaccine in the Philippines is not mandatory. However, the government encourages the public to get vaccinated and be protected against the preventable disease. This can protect each individual from getting severe COVID-19. As vaccines are starting to roll out, the government has made the vaccine available to the priority list groups, such as the frontline health workers, senior citizens, indigent population, and uniformed personnel. But as time passes by, we need to make a decision in order to attain herd immunity. So, will you take the vaccine or not? Our goal is to see the perspective of people based on their perception of the virus. In the end, it is your decision, but we encourage you to value each other's humanity and feel more empathy.
Viola Castillo has 3 children. She says not all of them have been vaccinated. That's because she's afraid. She says vaccines have caused the death of many children. Although she admits that's just a story she's heard repeatedly.
Even if that coronavirus vaccine arrives, I won't do it. Even if it's free, I will still not take it. I am afraid we might get sick.
Because of the Dymvaxia controversy that is politicized, it affected the perception of the public towards the COVID-19 project. 1/3 of those surveyed demonstrated COVID-19 vaccine hesitancy, and only 66% of Filipinos were willing to get the COVID-19 vaccine. Many will argue that politics is intertwined with public health. Thus, many are afraid that this is a form of another experiment done by the government. This risks public health instead of supporting herd immunity. Another factor is the vaccine hoaxes and misinformation all over social media. According to Naomi Lourdesabaldado of the Manila Times, vaccine hesitancy could be due to conspiracy theories, general distrust, beliefs in alternatives, or concerns about safety. There is falsely claimed information that has been spreading all over social media, which may have caused the refusal of the vaccine. This leads to the question, should you get the vaccine? In this pandemic, the vaccine is the most viable solution. Thus, the government must regain the public's trust through consistent messaging, transparency, and respect for science. This way, collective immunity will be attained, and only then can the end of the pandemic be achieved. Now, is it even possible to do the right thing? Oxford Professor of Medical Ethics Dr. Dominic Wilkinson shares that these questions are actually everyday questions. Thus, there is no need to rush judgment. Instead, we should all critically analyze everything in order to come up with the best solution. As he quotes, philosophy can help inform what we ought to do, given what we know. Wilkinson adds, Decision involves values. There may be an obvious ethical answer to a straightforward question, but when you're making an ethical and political decision, all sorts of different values are at stake. How to protect the well-being of the people with COVID or of the unemployed or someone with cancer. The trickiest time is still ahead. We could be facing something worse than the first wave, and we will need to make a decision on things such as who gets the vaccine first. There are many more ethical decisions than just the lockdown. We don't know yet what people will tolerate, what they will do. The blame game has a long way to run, particularly for those whose decisions do not stand up for scrutiny. Again, we leave you to the question, will you take the COVID-19 vaccine or not?